Okay. So today we are going to learn CPT surgery cystoscopy coding pre-webinar. So basically, whenever you go to live coding for same day surgery, most of the time you will encounter cystoscopy procedure. Okay. So the other name for cystoscopy is cystourethropy. So what is cysto, guys? Write in the comments. What is cystoscopy? Anyone knows? Write in the comments if you know. Why means if you understand this word, you can code any type of cystoscopy procedure easily. Okay. Yeah. Cysto means bladder. So scopy means examination basically. So examination of the bladder is cystoscopy. Yeah, correct. But I don't understand what is that cyst. Okay. Cysto means bladder. That is perfect. Okay. Next, if you are looking for any jobs in UAE, India and USA, please join in or please send your mobile number to 707 526 3939. So I will add you in our WhatsApp group. So we are having 10 WhatsApp groups. Okay. And also if anyone looking for same day surgery coding training, please send WhatsApp message to 707 526 3939. Okay. Yeah. No worries. No worries. So next, so whenever we want to code CPT codes, we need to understand the anatomy first. Okay. So in today's session, we are going to learn cystoscopy, correct? So now we need to understand what is cystoscopy basically. So this is the anatomy of urinary system. These are the right kidney, left kidney. These are two ureters. This is the urinary bladder. This is the urethra. Okay. So using the cystoscopy, patient will examine bladder or kidneys, guys. What patient will examine using the cystoscopy? Write in the comments. What he will examine? Yeah, bladder. Perfect. So here patient will examine the bladder. Okay. So these are the anatomy of urinary system. Most of the time, while coding urinary procedures, three things you need to remember. Okay, anatomical point of view. So first, you need to understand we have only one urethra. Okay, and one bladder, and two ureters and two kidneys. Okay, for urethra and bladder, you will not append any type of laterality modifiers. Why, guys? What is the reason? You can't append laterality modifier to urethra and bladder. What is the reason? Write in the comments. If anyone knows. Yeah. So yeah, perfect. Yeah, these urethra and bladder are not paired organs. So because of that reason, we need to code only. We will not code or we will not append any modifiers along with urethra and bladder. But along with ureter and kidney procedures, we can append modifiers. Why means these are the paired organs. So left side ureter or right side kidney, right ureter. Okay, left kidney, left ureter. So here we can append modifiers, but urethra and bladder we can't append modifiers. This thing you need to remember. Okay. So next, whenever you are going to learn this cystoscopy or urinary system, we need to understand few terminological words. Okay. So we will learn the terminology now. So what is cystourethropy, guys? So cystourethropy is the process of examination of bladder, urethra, and uterus opening with cystourethroscope. Okay, so examination of urethra, bladder, these are the ureteral openings. So examination of these three parts is called as cystourethroscopy. Okay, so basically we are having two types of cystoscopies. In CPT coding, cystoscopy or cystourethropy both are same. Don't get confused. So cystoscopy and cystourethropy both are same. Okay. In cystoscopy, we are having two types of scopes. One is rigid cystoscope and next one is flexible cystoscope. Okay. Most of the time, physician will use rigid cystoscope for biopsies or tumor removals. Okay. And most of the time, physician will use flexible cystoscope for diagnostic use. Okay. So if you go to interview, they will ask you what is the difference between rigid cystoscope and flexible cystoscope. So you need to tell them most of the time physician will use rigid cystoscope for biopsies or tumor removals or any type of therapeutic procedures basically. Okay. Flexible cystoscope is for diagnostic use. Okay. Next we need to understand urethra. What is urethra? So urethra is a tube that carries urine from the bladder. So this is the bladder. So this is the bladder. From the bladder through the urethra, urine comes out. So basically, urethra is a one tubular structure which will release urine from the bladder into the outside environment. Okay. Next, we are having ureteral opening. So what are ureteral opening? So these are the ureteral openings. These two openings here you will see. These are the two ureteral openings. One is on the right side. One is on the left side. Okay. These ureteral opening we can see in the bladder. Okay. Next, ureteroscopy. Okay. So what is ureteroscopy here? Examination of the ureter. So these are the two ureters here. Examination of this scopy is called as ureteroscopy. Okay. So basically here in CPT coding, all scopies are minimally invasive procedures. Okay. Or non-invasive. Means non-invasive means here physician will not create any type of incision. So for example, if the physician wants to perform cystourethropy, he will insert cystoscope through the urethra into the bladder. Okay. So here physician is not creating any incision, correct? So these are non-invasive procedures. Non-invasive means no surgery or no incision basically. So through the artificial opening, physician will insert cystourethropy. Okay. Next, BPH. Most of the time, physician will perform this cystoscopy for examination of BPH. What is BPH, guys? Anyone knows? What is BPH? Anyone write in the comments? So BPH means benign prostatic hypertrophy. Okay, like prostatic tissue enlargement or prostate gland enlargement. Next, suprapubic cystoscopy. Okay, cystoscopy via a suprapubic opening. Okay, if the patient performs cystoscopy through the suprapubic, supra means above, pubic means above the pubic area. We need to call it as suprapubic cystoscopy. Okay. So what do we need to understand here? Whenever physician performs cystoscopy, we have two options. One is through the urethra. Okay. One is through the suprapubic area. So using these keywords, you need to code these procedures. Next one is ESWL. Okay. So what is ESWL? So if you go to interview, they will ask you what is ESWL. So basically, most of the time, physician will perform ESWL for stone crushing. Okay. So ESWL means 1 minute. Extracorporeal shock wave lithotripsy. Okay. So if the patient wants to crush or distract the stones, patient will use this technique. So ESWL, which is a non-invasive kidney stone treatment using a lithotripsy. So ESWL means extracorporeal. Outside the body, patient will place the mission or lithotripsy mission, and he will crush the kidney stones. Okay. So those are the things you need to understand if you want to learn cystoscopy. Okay. So these are the anatomical terms you need to understand. Okay. So next, we need to understand stent insertions. Okay. So we are having, as we have discussed previously, we are having two types of stone crushing. Okay. First one is percutaneous ureteroscopic lithotripsy. Okay. Using this method, physician will distract the kidney stones using ultrasound or any type of mechanical lithotripsy. Okay, percutaneous ureteroscopic lithotripsy. So through the percutaneous approach, patient will not insert any type of cystoscopy here. Okay, directly he will go to kidney and he will create an incision and he will insert the lithotripsy mission. So in that procedure, in that type, patient will crush the kidney stones. Okay, so that approach we will call it as percutaneous ureteroscopic lithotripsy. So if you go to interview, they will ask you, what is lithotripsy? What is lithotripsy, guys? What is lithotripsy? Anyone? So basically, lithotripsy means fragmentation of the stone. So if you go to interview, na, they will ask you, yeah, yeah, that is also fine. Crushing of stones, fragmentation, distraction, all are same. Okay. So if you go to interview, they will ask you, what is lithotripsy? Just you need to divide the word. So tripsy means crushing, litho means stone. So crushing of stone is called as lithotripsy. Okay. We are having two types of lithotripsies. One is percutaneous ureteroscopic lithotripsy, and next is very common, which is transurethral ureteroscopic lithotripsy. So in first type of like lithotripsy, physician has performed incision on the kidney and he fragmented the kidney stone. In second method is transurethral. So this is the most common procedure in live coding you will experience. Transurethral. So through the urethra, physician will insert the cystoscope, and along with cystoscope, physician will insert ureteroscope and he will crush the stones in the kidney. Okay. So what do you call this one? Transurethral ureteroscopic lithotripsy. Okay. So using this procedure, physician will remove the stones in the ureter as well as the kidney using the transurethral approach. For example, if the patient is having the kidney like stones in the only kidney, physician will prefer percutaneous ureteroscopic lithotripsy. For example, patient is having stones in the both ureter as well as the kidney. So that time physician will use this transurethral approach for cystoscopy along with ureteroscopy. So these two procedures are useful for crushing of stones. Okay. So that is the types of lithotripsies. So next, we need to understand stent. What is a stent basically? So what is a stent, guys? So basically, stent use a tube. Patient will use this tube to open the hollow structure. For example, patient is having like stenosis in the ureter. So because of that, patient is unable to urinate. As there is a stenosis in the ureter, this urine will not come to the bladder. Okay, so that time physician will perform stent insertion. So most of the time the purpose of stent is to preventing the blockage. Okay, so most of the time physician will use temporary stents during the urinary procedures. If the blockage is very severe, patient will use permanent stents. So basically these stents are the plastic tubes which patient will insert in the ureter. Okay, so any doubt guys here? So if you are having any doubt, please mention in the comment section. I will give you 2 minutes. Yeah, that is the purpose of stent. So basically, if the patient is having any stenosis in the ureter, patient will use this stent. Okay, so using that stent, patient will reduce the or patient will provide the free flow of the urine from the kidney to bladder. Okay, so that is the purpose. So any doubt guys here? Yeah, correct. So basically we can't judge. So stents are various types. So physician will decide what type of stent he wants to use. We don't need to worry about the type of stent. Okay. So whether it is mesh stent or iron stent, we don't need to worry. Just we need to understand stent insertion. That's all. Okay. So what are the general tips for cystoscopy procedures? Okay. So during the cystoscopy procedure, first physician will examine the bladder. Okay, so through the urethra physician will insert cystourethoscope and he will examine the bladder. So basically we will call it as visualization technique. Okay, if the patient is having any stone, physician will use the fragmentation method in order to crush the stone. Okay, and if the patient is having any stenosis in the ureter, physician will insert the stent in the ureter. So as we have discussed, for example, physician will use insertion of stent in the right ureter. So you will code CPT code along with RT modifier. Okay. So that is the thing you need to remember. So next we will see few codes here. So whenever you want to code cystoscopy, you need to check approach. What is the approach? How physician is inserting the cystoscope, whether through the transurethral or suprapubic. Mostly you no need to worry. Live coding, na mostly they will use the transurethral approach only. Okay. So next we need to see few codes. First one is this cystoscopy procedure starts with 52000. Okay, 52000 is what guys? So open your CPT book. What is 52000? What is 52000? So basically 52000 is a separate procedure. Okay, here physician will perform only examination of the urethra and bladder. Okay, so that is 52000. Open your CPT books. Next 52005. Okay, so basically this 52005 is used for cystourethoscopy with ureteral catheterization, allowing visualization and access to the ureter. So basically, for example, patient wants to perform any radiological procedure. Okay. So that time installation of contrast, we will use this 52005. So if you see your CPT book, they have mentioned exclusive of radiological service. Okay. So means you need to code radiological service separately along with 52005. Okay. Like 50,000 series code as well as the 70,000 series code. Okay. Next one is 52310. Okay. Next one is 52310. What is 52310? Cystourethropy with removal of foreign body, calculus or urinary stent from urethra or bladder. So simple. Okay. So basically, if the patient wants to remove the foreign body, calculus or stent, we need to code 52310. Next, we are going to discuss three codes. These are very, very important for live coding. 52332. Okay. What is 52332? Cystourethropy with insertion of indwelling urethral stent, Gibson or double J stent. Okay. So 52332 is only insertion of stent. Okay. If the patient insert the stent using the cystourethropy, we will use 52332. In 52332, patient will not perform any type of lithotripsy or crushing of the stone in the ureter. Okay. So whenever you want to code 52332, you need to check the medical necessity. What is the medical necessity for this procedure? So we will use 52332 if the patient removes the stent too. Otherwise, we will not code this one. Okay. Next 52352. Cystourethropy with uteroscopy and removal of calculus, focusing on the extraction of stones from the ureter. Okay. So 52352 is for removal of stones. Okay. With removal or manipulation of calculus, uteral catheterization. Okay. So cystourethropy with uteroscopy and or piloscopy with removal or manipulation of calculus, ureteral catheterization included. So here if you see the code description, ureteral catheterization is included already. So you need to code separately. So that is the guideline they have mentioned in the bracket. Okay. So basically you need to use 52352 is for removal of stones. So here there is no or insertion or removal of the stent. So 52356. This is the most expensive procedure or extensive procedure. Okay. Where fish will perform lithotripsy along with stent insertion. In live coding, 90% of the time you will code 52356. Okay. So here what happens? So through the urethra, patient will insert the cystoscope and he will examine the urethra as well as the ureter, and he will perform lithotripsy also, crushing of stones in the ureter as well as the bladder, and along with that he will insert the stent. Okay. So that time you will code this one. So for this procedure your post-op diagnosis will be kidney stone or ureteral stone. Okay. If you want to code 52356, kidney stone or ureteral stone. So like that we need to code the cystourethropy procedures. Okay. So any doubt guys? Any doubt in here? Cystourethropy clear. So if we don't have any doubt, we will conclude here. So thanks for visiting our channel. So if anyone looking for same day surgery training, please send WhatsApp message to 707-526-3939. If you like this session, please click on like button now. So it will motivate me to provide more sessions every week. Okay. So any doubt, Ramya, Rao, PR Go Chittiraju. So now it is your turn. Yeah. So if you are having any doubts, Ramya, you can anyway next week I will post this video on YouTube. So if you are having any doubt, you can ask now. No problem. So you can write in the comment section. I will try to explain. So basically only few things you need to remember. 99% we will get like what do you call transurethral approach only. Okay. So okay guys, thanks for coming. So if you like this session, please click on like button. So which will motivate me to provide more sessions like this every week. Okay. So okay guys then bye. Take care Ramya, Raju.